Hello and welcome to the Inland Empire Healthy Living Virtual Expo. It's hosted today by the Press Enterprise, the Inland Valley Daily Bulletin, the Sun, and the Redlands Daily Facts. My name is Julie Corlett, and I am from the Southern California News Group. So again, thank you for joining us today. I'm really excited about today's session, which is sponsored by Kaiser Permanente, and it is presented today by Dr. Gerald West. He will be talking about the importance of prevention measures in our health. Just so you know, this session is being taped and a link will be sent to you. Feel free to type in questions or anything in the chat. We do have people that will monitor it and we can address them at the end. And on that note, I want to say welcome, Dr. West.
Okay, well, good afternoon. Hopefully everything. I'm going to go ahead and start into the presentation. So we're going to have a question and answer session at the end. So I want now to focus on the presentation. So you'll be able to hopefully see my screen. So once again, good afternoon, everyone. Thank you for signing on. And in the next 15 minutes, I will be discussing the important topic of prevention. Prevention is such an inextricable facet of Kaiser Permanente nowadays that we almost forget why this has historical relevance. You know, one could argue that from our inception, the unique healthcare plan that became Kaiser Permanente placed preventive medical services front and center. Henry Kaiser and Dr. Sidney Garfield collaborated to provide medical care in 1938, not only to the men building the Grand Coulee Dam, but also their wives and their children. This was done in even a greater scale for the 30,000 workers at Henry Kaiser shipbuilding facilities in Richmond, California during World War II. These prepaid comprehensive medical programs incorporated preventive care when preventive care was not popular at the time. So from these early roots has evolved the healthcare behemoth that Kaiser Permanente has become. Now, our model is fully integrated. You know, our goals and objectives are aligned across the entire organization, both vertically and horizontally. And most importantly, this level of total integration is supported by evidence-based medicine, driven by the most sophisticated electronic medical record system. But in 1945, Integrated also held another important meeting when the health plan was open to the public. It reflected a deep commitment at that time to being one of the first healthcare providers in the United States to have a racially integrated hospital and waiting rooms, as well as an ethnically diverse workforce, including physicians and allied health professionals. Therefore, when we speak of culturally sensitive care and population care management, this is part of Kaiser's DNA and remains a critical driver of our medical success. Consider the fact that 90% of US healthcare is still fragmented. It's still managed in a reactive, disjointed approach that leads to costly, poorly coordinated care. So why do our members love us? Well, typically medical services are spread around town. Primary care physicians do not work all the time in the same offices as specialists. Imaging centers are in one place, the pharmacies in another, not to mention the labs to draw the blood. Now, we are at Kaiser Permanente connected by the same medical record system, so everything is coordinated. Healthcare in this connected model is immensely helpful from a physician standpoint, but more importantly, saves the member time and money and imparts a peace of mind in knowing that their health is being coordinated by a team of physicians. We are all familiar with Benjamin Franklin's statement, an ounce of prevention is worth a pound of cure. So he was at that point speaking to Philadelphians at the time who were concerned about the threat of fire in their city. So similar to Benjamin Franklin's admonition, the Kaiser Permanente model places front and center that preventing fires is better than fighting them. So let's look at the facts. Chronic diseases account for 7 out of 10 deaths and 75% of all healthcare spending. And moreover, most chronic diseases are preventable and the rest manageable through close partnership with the primary care physician. There is quite a bit of research that substantiates the benefits of purporting preventive care within a healthcare management system such as Kaiser Permanente. This is evidenced by the U.S. Preventive Services Task Force, among the most respected panel of national experts in disease prevention, as well as the CDC, who we've grown to appreciate even more during this pandemic as a national preeminent health protection agency. We rely on their research engines to direct our preventive care efforts. Ultimately, when it comes to our members, and especially to our senior population, Kaiser Permanente delivers on its promise. It is better to take severe precautions than to suffer severe consequences. This feeds right into the KP mantra of staying well and thriving. And these pictures exemplify this credo. And of course, it is always encouraging as a physician when Kaiser Permanente is awarded some of the top honors and awards in this country year after year. Now, to name a few, in Consumer Reports, Kaiser is a top-ranked health plan in every market we serve. In the Leapfrog Group, which surveys close to about 1,200 hospitals nationally, and from that selects 92 hospitals for the top hospital award. It's actually impressive that 19 of them were KP hospitals. And of utmost significance, when we look at the Centers for Medicare and Medicaid Services, also known as CMS, Kaiser Permanente has a history of maintaining 5-star ratings year after year. Medicare makes up 37% of our current national medical spending, but only represents 13% of our population. It's estimated that by 2030, this population is going to reach close to 19%. Now, the Medicare Star Quality Rating System provides beneficiaries a way to assess Medicare plans' quality of care and service delivery so that they can actually make an informed decision when choosing a plan. Now, Kaiser Permanente is proud to be among the highest rated Medicare health plans in the nation. Kaiser Permanente Medicare health plans achieved 5 out of 5 stars this year in 6 out of the 7 that have received CMS contracts. More importantly, these ratings underscore our organization's commitment to providing our patients with the high quality medical care and experience they expect and deserve. So the value proposition of our integrated chronic care management is not just theoretical, it's actually very much proven. When comparing the percentage of healthcare dollars spent on major chronic conditions, Kaiser Permanente is competitive when compared to the market average. Now, this translates into dollars saved per 1,000 enrolled members, and this pays dividends both financially and in the health and productivity of our members in society. A core tenet in being able to prevent many chronic diseases is being able to make substantive and sustainable lifestyle choices. You see the percentages below. Sure, there may be some genetic contributions here. However, it really comes down to the choices we make that exert a profound influence on disease manifestation. And we know that the decisions are not easy. You know, many of them start in childhood and are predicated upon what we observe from our parents. But ultimately, the buck stops here. You know, we all possess the power to make good decisions. The question is, how frequently do we make them? So let's turn the page just a little bit, just to talk about obesity for a minute. It is so important that we address this issue. 70% of adults in the United States age 20 or over are overweight or obese. And in Southern California, we have a great example of how this played out, unfortunately. Some of you might remember in 2007 when the Small World ride at Disneyland had to undergo massive overhaul. Now, let's be clear that it was not because there was some new Disney magic they wanted to add to the attraction. You know, unfortunately, from 1964, when it was constructed, to 2007, we added our own magic to the ride in the form of obesity. So the boats were bottoming out and stopping the ride from functioning. Tragic. So it is an undisputed fact that the higher a person's BMI, the higher the risk for developing certain chronic diseases such as heart disease, type 2 diabetes, hypertension, obstructive sleep apnea, and some of the cancers. It is also relevant to point out the evidence that a higher BMI causally increases the risk for depression and not the reverse. Keep in mind that the very important fact that a low level of fitness is a bigger risk factor for mortality than mild to moderate obesity. Otherwise stated, and I say this to all my patients as well, motion is the lotion. We always have to keep on moving. It's also very interesting that people's perceptions of their own risk of illness depends on the people around them. Spreading positive health behaviors is possible when modifying a person's social network. So let's consider the fact from this slide that if you have an obese close friend, your chance of being obese has actually increased 171%. Let me just say that again, 171%. So that should all give us a moment of pause. So when we stratify the layers of preventive care, we can characterize them as being either primary, secondary, or tertiary. From left to right, we see how the questions evolve from how can we prevent disease to how can we detect disease? And then finally, to how can we prevent further harm from disease? Now, outside of Kaiser Permanente, talking about cancer care is inconsistent. Patients cite poor information sharing from their doctors, treatment delays, and communication barriers between physicians that negatively affect the quality of care. We do more to help catch cancer before it becomes a life-threatening condition. In the most basic sense, we're different from other carriers. Yes, we're a health plan, but one that's part of the same organization as our physician groups. This is integrated care delivery system that allows us to seamlessly and effectively care for members as a team, making sure everything from a preventive cancer screening to an oncology visit to the lab test is all interconnected and often under one roof. It's the difference between a fragmented approach and a coordinated physician community. And it's working. With Kaiser Permanente, you've got a better chance of surviving colon cancer, for example. While our membership continues to grow each year, our incident rate of colon cancer has actually decreased. And our 5-year survival rate for members diagnosed with the disease is 75%. That's significantly better than the national average of 65%. So then we come to what are the recommended forms of prevention. So there are certain recommendations among medical professionals that are consistent from age group to age group. For example, as human beings, we must always remain physically active. Like I said before, motion is the lotion. By the time we become seniors, however, we can reasonably anticipate that our ability to maintain a healthy weight, get restful sleep, and not to smoke throughout our lifetimes should pay a positive dividend. For those who are 65 years and older, vision and hearing, for example, play a significant role in maintaining equilibrium. This, of course, plays a role in helping to prevent falls in our senior population. And then when we look at our cancer screenings that I alluded to earlier, screening for colon cancer begins at the age of 50 for most. However, it can start at the age of 45 years of age for more vulnerable populations. When it comes to mammograms, women ages 40 to 44 should have the choice to start annual breast cancer screening with mammograms, and cervical cancer screenings actually begin at the age of 21. Now, when it comes to diabetes, the American Diabetic Association has recommended that screening for diabetes should begin at age 35 for people who are considered overweight. And finally, bone density testing should begin for all women 65 years or older and for all men 70 years and older. Now, we have recently witnessed the importance of prioritizing seniors when it comes to the COVID-19 vaccination. Unfortunately, it's safe to say that COVID-19 will be with us for years to come. So if I were actually giving this presentation, 1 year from now, I think that in addition to shingles, pneumonia, tetanus, and flu vaccinations, we will more than likely see COVID-19 vaccinations added to this list as well. Through KP Health Connect, we can go beyond the typical preventive outreach that most plans do. When a member comes into one of our facilities, our caregivers review an on-screen preventive care checklist that alerts them if a member is overdue for preventive screening. In fact, any authorized caregiver has access to this information and can take action. So it's built into our system. So whether a member is visiting his or her primary care physician or a doctor in the urgent care, our care team is alerted for overdue tests. Ultimately, we finish where we focus. By taking an ounce of prevention, we create healthier tomorrows. From our inception with Henry Kaiser and Dr. Sidney Garfield, preventive care has always served as a quintessential building block to our DNA at Kaiser Permanente. Thank you for your attention. Be well and thrive.
Thank you so much, Doctor. This is really great information. We appreciate you taking the time to speak to our attendees today. I just want to finish up by letting people know that if they want to follow up on any of this information, you can go to mykpagent.org /IVETTES, and she will be happy to answer any of your questions. And on that, if there's nothing else, oh wait, looks like something just came in. Let me just double check before we go. Okay, wonderful. Adrienne was saying, thank you so much for the information, Doctor. So again, you all have a great day, and we look forward to seeing you at future events by Southern California News Group. Have a great day. Bye-bye now.
Thank you.